So again, my name is Jody Sanderson, and I am with Acclaim Physician Group in Fort Worth, Texas. I am the Director of Physician Recruitment and Compensation. A lot of you will notice that in my title there is no marketing portion. So I think that goes along with, or it's a big part of our story, and I'll get into that. But a little bit about the organization. So we are the physician group that supports John Peter Smith Hospital. We are the only level 1 trauma center in Tarrant County. Tarrant County is comprised of about 2.1 million people. We also have the only psychiatric emergency center in Tarrant County. We are a large teaching facility. We have many residencies and fellowships. And we are the only U.S. hospital in the U.S. That's a level 1 trauma center that's certified in stroke, heart attack, sepsis, and delirium care. So as I mentioned earlier, there's no marketing in my title. I do not have a marketing background. And with Acclaim, we do not have a marketing team. So JPS has a marketing team, but we are 2 separate entities, and so they don't always have the bandwidth to help us with marketing for the physician group. So triggers that, of course, led to us needing a website redesign was that we have no marketing department to update our website, and our website was very funky, kind of like Grand Rapids. It was unstable in WordPress, so if we made any alterations or made any updates, you know, with COVID, if we needed to make announcements, we were worried that that was going to crash. And we wanted to also better connect with our community and provide our providers with a provider directory that would allow patients to find them more easily. We also did not have any content, and our site was not mobile friendly. So here you can see our new Acclaim site on each of our different devices that we have. So we launched at the end of May, right in the middle of COVID. So like I said earlier, we were able to launch, and we really kind of pushed our launch date sooner than we had thought because we needed to be able to communicate out to our patients different alerts through COVID. We had to shut down multiple clinics through COVID, and we needed to make our patients aware. So having this new website where it was mobile friendly and it presented well on multiple devices was key for us. Another big thing we needed was our provider directory. So when I first went to look for a vendor to help us, I wanted to see that they had experience with our current credentialing system because I wanted to have an API that linked to our provider directory. Well, then I found out that the credentialing system that we were using, we were sunsetting. So my team, one guy and myself, and I actually had some recruiters help out, ended up having to put our provider directory in manually so I could save my API hours for a later time. But that's one thing that Geometric does have. They can link to multiple credentialing systems to where that can feed when you have new hires, it goes straight into the provider directory, which we love. We will love as soon as we get it up and going. But for now, we've received so many compliments on our provider directory. We have over 450 providers, and we had over 350 that filled out a survey that they wanted their profile to be more robust. So a lot of our providers had additional certifications, their interests. For example, we have a surgeon that is very interested in thyroid, and no one would know that by Google searching him. So in his special interest, we have thyroid, so people can find that in our website. So for our new user-focused content, we also, from our website prior, did not have content at all. It was clunky, but it didn't even have anything that was searchable or told anything about our facilities or our providers. So we had Geometric develop 32 new service line content pages, and we're actually still adding as we speak. They developed all of the writing and used their web best practices to help us develop the content. We had surveys that went out to our service line administrators and our senior physician executives to help get us all the data that we needed. So our physicians, of course, wanted everything very scientific, using big words, but working with Geometric and being that we are the safety net facility for Tarrant County, most of you that are in marketing will know website content needs to be at about a 7th grade reading level, but in doing some data dive and some interviewing with some patients that we have, it was determined that we needed our website to have a 3rd grade reading level. So we really had to tap in and depend on Geometric to help us explain this to our physicians and trust that they were the experts when it came to healthcare web development. So you can see here on the slide some of the content they developed. And what I love about the content that they developed too is there's a lot of cross-linking. So again, with our patients, you know, what they search for in one manner or another will get them where they need to go. So in our connections between providers, locations, and services, this was big for us too. Having our patient population that may not have transportation or may not have access to a direct bus line. On our previous site, they couldn't really tell where they were or when they were there. So having it link our providers to where they are at, which day they are at, was very helpful for those who need help with transportation. And here you can just see some more content that was developed. You can see here on the next slide, another physician that we have in our directory. And you can see the location and service line from the provider profile as well. Again, it's much simpler. There's a lot of cross-referencing where you can find things through multiple pathways and different searches too. So again, with our patient population, you know, most of us on the phone know that a cardiologist is a heart doctor, but a lot of our patients may not know that specific term. So our next slide are results since our launch. We've seen increased usage by 38.1% and a 58% improvement in our clicks from Google. What I thought was very interesting was our increase in pages per session. Again, because we have content and something for people to read and spend time on our site, we saw a huge bump there. And then total traffic increased as well each month. And then here you can see results compared to industry average, 30 seconds longer time spent on the website. More pages are looked at per industry average. And we also have a lower bounce rate.